Well, let me begin. First of all, how are you feeling?
I feel great, Pat. I didn't feel so good last week, but I feel like I'm 100% and ready to go. But this was quite an experience, believe me.
What is your status at the moment? Is your quarantine over and you're now cleared?
Yeah, the quarantine ended Sunday. Yesterday, it was a 10-day period from the onset of the symptoms. I spent the time by myself, reading, listening to books, on conference calls with regard to Afghanistan, but basically was isolated for a full 10 days.
Not to get too personal, but can you describe the symptoms you were having?
Yeah, easily. It was like the worst head cold you ever had, times two. Sore throat, off and on fever, chills, body ache, headache, and cough, to the point you probably had a cough where your ribs hurt when it coughed, and that was the way it was. It was like I say, it was like a really bad head cold, and I felt that coming on Tuesday a week ago, and then 2 weeks ago actually now, and the next day decided I better get a test just to be on the safe side. I didn't expect it to be positive, but it was. And that's when I went into the isolation.
And it presumably had been about 8 months since you'd been fully vaccinated, right?
That's right. And I think that's one of the messages I want to convey is you can't let your guard down. I'd been fully vaccinated, felt fine, and I was still wearing a mask on airplanes and around the Capitol in Washington, but I wasn't as diligent as I probably should have been about social distancing. And listen, Pat, if I hadn't been vaccinated, I'm quite sure I would have been in the hospital. It would have been much more serious. I don't want to ever go through it again. But boy, the vaccination was, I think, in this case, a lifesaver.
And you're probably in line for a booster before too long.
Well, actually, I'm told now I don't need or shouldn't have a booster for 3 or 4 months because of having had COVID. I'm about as immune as you get right now, having had an original vaccination, and then having actually had the disease. So the doctor said no booster for 2 or 3 months. But if people have been vaccinated, I don't know what the guidance now, I think it's 8 months, they ought to be thinking about going in and getting that booster.
You've no doubt been made aware of the dust-up that's been going on throughout the state over Governor Mills putting in a vaccine mandate for healthcare workers. And there's, a lot of people are saying they'd rather quit their jobs than do that. How do you react to that as somebody who has been through this condition and also having been a governor trying to keep people safe?
Well, that's the governor's first job, is to keep people safe, and you put your finger on it, and that's exactly what she's trying to do. Listen, Pat, I got to tell you, I just don't understand this stuff. We all were vaccinated when we were kids for polio, for mumps, measles. You couldn't go to school without being vaccinated, at least when I was a kid. I suspect that's still true. This is another disease with another vaccine. Hundreds of millions of people have taken it without serious side effects. It's been through the review process. It's gotten final approval from the FDA. And here's the thing. If it were only you, okay, make that decision. You can make that decision for yourself. The problem is you're making a decision that could very well harm other people. You could contract this disease because you haven't been vaccinated and then spread it to somebody else. And, we all abide by rules that restrict our freedom in some way. I'll bet you that you drive on the right side of the road and stop for stop signs and stop for red lights. That's an invasion of your personal freedom, but it's one that's necessary to keep us all safe. I view this in the same category. And, people that say, I'm not going to get vaccinated, I don't care. They're really saying, I don't care about my mom or my grandmother or other people that I might meet on the street. I don't get it. There's no scientific basis for it. And it's not like vaccines are anything new. George Washington mandated vaccination among the Continental Army during the Revolutionary War.
Yeah, when smallpox was killing people left and right.
Right. And this isn't over. Somebody said to me this morning, we may be through with the pandemic, but it's not through with us. I mean, I think 15 of our 16 counties are now in high risk areas. And, again, from my own personal point of view, if I hadn't been vaccinated, I think I'd have been in really serious trouble. And all the science is 99% of the people who are in hospitals now weren't vaccinated. And 90+% of the people who are showing symptoms like I did after being vaccinated never have to go to the hospital. So
even in a state like Maine, which has done well at vaccination rates in general, we're still seeing this happen. Anything else you want to add about that before I move on quickly to another subject?
No, I think you got it. I mean, my basic message is this is no joke. Take it seriously. Think about other people. Get vaccinated, and let's get over this thing.